How were you feeling when you first came in? When you first saw Dr. Lemmo, when I sat in the room with you.
He's helped me. He did my leg, which is about 95% now, and my arm, which is, pretty good.
Yeah.
And my face. He actually moved
And this is Dr. Lemmo that
yeah,
did this.
yeah. He moved instead of going like this, it has a normal.
Wow. Yeah, you absolutely.
Yeah.
I remember seeing you, but can you please maybe explain what happened? Because we missed that part. To you, what happened? What triggered all this?
I don't know.
Well, he did the stem.
Yeah,
is
the
what
stem.
No, I'm saying, was it a stroke? What happened?
Oh, I had a stroke while I was having surgery. That was in April 29th, 2014.
And then what happened?
I stayed at Take 4 campus for 6 weeks, and then I stayed at Oak Park for 6 months. And then I went home to my condo, and I've been home for a year.
And what were you suffering from after the stroke? What were you?
When I got home from Oak Park, I was still in a wheelchair. I was on a cane, when I walked. And
then what brought you to Dr. Lemmo?
I was referred to him by another patient. As I said, he brought my arm up like this. My leg is, don't use the cane anymore, don't use the wheelchair. So
And how long have you been seeing Dr. Lemmo?
Only about 6 weeks, yeah.
So can I ask advice that you'd give to somebody maybe in the same situation as yourself, that you've gone through all this? What would your comments or words of wisdom be?
Well, don't worry about the money, focus on your getting better. And, and I think that most of the time people focus on the money instead of on getting better.
So you'd recommend them to see either Dr.
Yes,
Lemmo or
yeah.
someone?
Just take one visit and make up your mind then.
When you brought Sandy in, I remember, what were your thoughts?
Yeah, definitely some skepticism about because there isn't a whole lot of history about his procedure, and but Sandy was encouraged by the fact that this other gentleman had been seeing him and had some results. So, and as we got to meet him, we saw I saw that he was a real professional, and his training was certainly awesome and inspiring. That he had gone through all that training, and and since then I've seen some progress in Sandy. So it's probably slower than everybody would like it to be, but something's happening in a positive way. So we're just going to stick with the plan.
Are you still skeptical?
Not as much. No, I think it's proven. And she's positive about it, and so that's the important thing and so am I.